Hi, everyone. My name is Dani Sychowski. I am a fourth-year medical student in the Chicagoland area. Very proud to have been a Capello Health Advocacy Fellow this year. I've been a part of Doctors for America's Community Health and Prevention Impact Area and a co-chair for the Gun Violence Prevention Subcommittee. I wanted to talk quickly about where my advocacy journey started. I knew I wanted to be a doctor from a very young age, but my advocacy journey didn't really start until about the time of the COVID-19 pandemic. It was right before medical school for me, and I got involved with a more local group in here in Illinois, Impact. Dr. Halleck Varnia was also a member of this group, and we did a lot of work first around the COVID-19, putting out infographics, debunking misinformation. But I really found my footing with this group through their gun violence prevention work. We attended Wear Orange events, and it was a really great way for me to step into kind of local advocacy in Illinois and the Chicagoland area. Once in medical school, I really started to feel that advocacy was something I wanted to get involved in a little more deeply. This is when I got involved with Doctors for America and have been doing advocacy work at the national level. And I've continued kind of locally at my own school with things like Stop the Bleed, bystander CPR, and other kind of public health initiatives. It's hard sometimes to want to get involved and feel like you can make a change, especially when you're just a medical student. Even in the clinical world, when we're on our rotations, we feel like we're kind of at the very bottom of the totem pole. So again, it's hard to feel like we can make that change. I would say if you are just a medical student like me, it's you got to find ways to get involved. I did this through getting involved with my campus organizations. I did this through Doctors for America. You can seek out mentors through these organizations. And it's a really great way once you're involved to get others excited. So one of the things that I did with gun violence prevention with the Student Osteopathic Medical Association was got involved in resolution writing. And I was able to put forth a resolution that called for incorporating gun violence prevention into our medical school curriculum. And that resolution was ultimately adopted. And from there, I was able to get others in my class and in my school kind of caring and involved with gun violence prevention just with that success and seeing that, hey, as a medical student, we do have a voice and people do want to listen and care about what we have to say. The ribbons here were from a recent American Medical Association meeting that happened to fall during National Gun Violence Awareness Weekend or Wear Orange Weekend, and I was able to put together these pins and hand them out at the meeting itself. So it was another great way to kind of get people involved on a very small level in remembering the survivors and people who have been impacted by gun violence. With Doctors for America specifically, we've done so much great work on gun violence prevention. We have collaborated with groups like AMWA, the American Medical Women's Association. We've done work with Newtown Action Alliance for their lunch and lobby sessions, where we're able to phone bank and also talk a little bit about the work that we do as Doctors for America. We've put together advocacy grand rounds. We bring together experts and panelists to share their wisdom, share their experiences. And we've also been able to put together infographics on things like extreme risk protection orders with a focus on how they relate to what the physician can do and what healthcare can do in terms of people who are at imminent risk. One thing that DFA has really strengthened for me is my network. So I've been able to network not just with DFA, but kind of beyond it as well. One of the events we put on last year through our gun violence prevention subcommittee was White Coats at the White House. We got to network with the White House Office of Gun Violence Prevention. But the DFA network is so wide and so deep. I've networked with other medical students from my fellow co-chairs to people just involved in the different impact areas and then beyond that as well. And that's really been a strength that I've been leading on and continue to look at as I move on my advocacy journey. So what's next? I think for me, I want to continue my work with DFA at the national level, but I really do care about my community level and my local level. And one thing I'm really passionate about is Stop the Bleed training and using it as a means of, okay, if we can't stop firearm violence, then maybe we can limit some of its impacts and some of its effects. So I'm really passionate about teaching others, bringing communities together, and just educating people. One of the things in Illinois specifically, I feel like very lucky to be in a state that takes gun violence prevention seriously. So just continuing to be involved with that and using our kind of DFA network here in Illinois. I really do want to thank my Capello cohort this year, all of this year's speakers during our monthly calls, Angie, Julie, May. You guys have been so incredible at laying the foundation for what it means to be a Capello Health Fellow. I really want to thank my current and former co-chairs of our JVP subcommittee, Colin and Anand, who Colin is one of my cohort Capello members this year, and Anand is a previous Capello member. I really want to thank Keisha, Rhea, Alyssa, Hala, Cedric, all of our CHP advocates that I've really gotten to know closely over this last year, and all of the DFA staff that put so much time and effort into making this what it is. Thank you so much.